Hi, this is Dr. Dan Dischiavo at Back in Shape in New Hartford, 315-732-2200, and today we're going to talk about neck posture, neck stretching, and neck strengthening. First of all, let's talk about posture. Under normal circumstances, we'd like to see, I'm going to give you a side view, we'd like to see the ear over the point of the shoulder. And as I approach my 50s, mine is starting to jut forward a bit, so I'm constantly working at keeping my head over my shoulders. And we're going to give you some things that can correct bad posture, which I do work at, and we're going to give you some things that will correct muscle tightness. So first, let's start with stretching. Of course, you're going to consult with your chiropractor before you start any stretching or strengthening program. But some basic stretches for the cervical spine would include forward bending, holding that for 10 seconds, and then returning to neutral. I'm going to go faster than 10 seconds just to get all this information across. So after straightforward bending, we're going to come to a neutral position, rotate about halfway, and drop it straight down from there. Hold for 10 seconds. Come back to neutral, rotate halfway the other way, and drop it straight down from there. After that, we can do lateral bending and lateral bending left. Of course, with this, you're not going to overstretch by pulling with your hand. We can injure the cervical spine doing that. Finally, we're going to do rotation to the right and rotation to the left. Again, holding each one for 10 seconds. For strengthening of the cervical spine and certainly strengthening of the postural muscles of the cervical spine, again, I'll turn sideways and I'll demonstrate what's called cervical retraction. So the idea here is to shear the entire head backwards on the body. I'm pushing my head straight back and I'm holding that position for a good 5 to 10 seconds and then relaxing to what's comfortable for me. The first mistake people often make is they extend their neck backwards and look up at the ceiling. We don't want that. We want your face parallel to the wall in front, and again, it's just a straight back movement. It's a little odd to get used to at first, but it does become more natural with repetition. Again, consult with your chiropractor if you have any questions regarding this exercise program. My name is Dr. Dan Dischiavo. I'm at Back in Shape in New Hartford, New York, 315-732-2200.